Welcome to the Inspired Impact Podcast, where dedicated female professionals share how they inspire impact every day. Authentic stories, passionate commitment, lives transformed. I'm your host, Judy Carlson. Welcome to today's episode of the Inspired Impact Podcast. Today's guest is the founder and owner of the audiology method. I am so excited to introduce you to Dr. Julie Link.
Thanks, Judy. Thanks so much for having me. It's a little intimidating to be on this stage with someone who's so inspiring. I'm really appreciative of you having me on.
Oh, well, I'm so glad you are. I can't wait to share your story. I'm just overwhelmed at how you've taken your life and developed it into who you are today, and I'm grateful. So why don't we start with, where do you want to start with your journey on to how you got to where you are today, inspired you to be on the path that you're on?
I don't know if we talked about this, Judy, when we first met, but I grew up on a farm in Ohio.
Okay.
And so growing up kind of small town, most people, we were the third generation on that farm. So most people stick around and very family oriented. So I saw a lot of people with hearing loss, right, impacting those family relationships, right, over time. And I put myself through school working in factories. So there's lots of noise exposure kind of all around, which got me interesting in the prevention and treatment of hearing loss. In addition to growing up on the farm, also surrounded me and kind of was full-time entrepreneurship, right? So my dad, ran the farm, but also worked full-time. My grandpa did the same, and now my brother and his kids are the third generation. So I think I always had this kind of idea that I was going to own something one day. Obviously, I didn't do the farm thing. It's the audiology practice. So I think I had some really great examples growing up on how to take that responsibility, but also to grow something really special.
So the factories are noise around you through school. You mentioned you saw some hearing loss because of the farm. So tell me what you experienced and what you actually saw happening around you in the hearing loss world.
Yeah, so kind of my first piece of interest was around prevention. So, culturally, and especially this is third generation, like my dad never wore hearing protection, right? My grandpa never did. And we were out there with both of them all the time. So we didn't either. And it's kind of cute now that they're on the third generation. They had like a little toy kit come in for my nieces and nephews. And it's the first time I've ever seen one have earmuffs in it. And I'm like, oh my gosh, how cool, right? Like that's now becoming part of that culture, right? Where we do take care of those things when we can safely, right? So that was kind of my first interest was, how do I prevent this from happening, right? That's always and that's our rule, in most healthcare is if we can prevent the problem in the first place. But because it wasn't prevented, I also was very interested in the treatment. So it's probably one of the most fun things that I get to do each day is to give someone back their sense, and you don't realize until you lose it and get it back, like how much joy just hearing the birds in the morning can be for someone. It's those little things that I love hearing about because it is really quality of life, and the little joys in those moments, they get to choose now, right? If they want to listen to it or not. But if you are untreated, you don't have a choice.
Right.
So that's been really sweet and fun to hear those stories.
So then you went off to college, and what did you major in, or what was the progression of your education through all of this?
I thought you might ask me this question. I've decided today I'm going to be honest. So when I went to college, I was, small town girl, top of her class. My dad had tricked me into getting all A's. He had told me that's what he did. And then after I was done, he said, no, I actually got all C's. So I was
Love
It
that
worked.
story.
Obviously, him and I are a little competitive with each other. So when I got to college, I was thinking probably pre-med. And when I went into that, I really got a big education on, higher ed and just college, because a lot of people back home didn't go, which is great. They still have good careers, but it wasn't that path. And I didn't quite feel prepared for it. So I got my first C, and I was like, oh my gosh, I can't do this. Right. Which is so funny now, because I do things all the time now that I can't do at first, but then you figure it out. Right.
Right.
So I changed paths and kind of looked at business communications. And then my roommate was studying speech pathology and audiology. So she's like, I think you would really like this path. So I and I had that personal interest, right?
Yeah.
From my noise exposure experience. So I went to that, and the speech pathology was great. Like, it was so fun to work with kids, but the progress was very slow. And then I went to my first audiology one, and it was like, wow, like we can change someone's life like in a day, and I know
Wow.
now it takes time,
Oh,
but it was
right.
really eye opening, and it was nice to be able to work with people. I'd say my family was very like strangely against like having attorneys in the families. But I think I would have been a great attorney, a great engineer, but I'm really people oriented. So I think this field for me has been great to use all of those different skills, and do teaching too, as you know,
Yeah.
has been kind of the perfect combination. So that's the honest answer, Judy, is I got a C in chemistry, and I changed my whole life plan.
I love how you pivoted off that C.
Yeah.
That's
Thanks. I'm
great.
glad I did. It was
Yeah.
meant to be, right?
So, what is the audiology degree program look like? How much education is it, and what did you do after you got out?
Yeah, it's a great question. So it's a very small field, which again, I think was the right pivot for me. Um, so once you're done with undergrad, you go on for 4 years to get a clinical doctorate in
Mm,
audiology, which
mm,
is comparable to like a dentist, right? Optometrist, right? Where it's PTs. Um, so we don't have to go to med school, and we can get back in the field quicker. So
mhm.
that is kind of what the field looks like, but audiology is very small. So like my class, there was only 9 students.
Wow.
There's only 10,000 audiologists in the country approximately. So it is very small. It's mostly women. I think, I don't know the actual stats. I should have looked that up for you before, but I would guess it's like 80%. And so it's been, yes, just a very rewarding field, and network of people. It's really lovely, and very special to be a part of.
So, you graduated from your clinical doctorate after 4 years, and then did you go to work for someone else's practice to start, or?
Yeah, so I did my studies in Chicago. That's where
Oh,
audiology was actually born, I think in World War II.
mm,
And it was great. I got to learn from so many incredible people, but they were all like hospital placements.
mm,
And, my little like farm girl, like I was like, oh, I kind of want to see if I could cut it, in a private practice.
yeah.
And so I applied to one job out here. And in the interview, it was so cute. They asked me like a question about chickens. And I was like, oh, these people are for me, right? Like, it's a nice full circle. And I got to experience what it was like to be in a private practice, and to really get to make relationships and stay connected with your patients throughout their
Mhm,
entire journey, because hearing loss is not acute. It's not like it just happens one time for most people and it's
mhm.
gone. It's chronic, it's ongoing management, and as their body changes, it changes their ears. So it was it was definitely the right fit for me, and I'm so grateful to them for that opportunity, that they gave me a chance as a new audiologist and someone without that experience. They really
Right.
helped me, to move into that world, which was great.
So that was out here in Colorado.
Yes, yeah.
Okay. And then how long did you work for them before you got that entrepreneurial itch to start your own practice, Dr. Link?
I think I'm trying to think, how old am I, right? I think it would have been 4 years, yes, of working with them and their big team before I went out on my own. Yeah, I think it was 4 years.
Okay. And so tell me a little bit about that journey from working for them to starting your own practice and setting it all up and the name and all the things that go along with your own business.
It's been 7 or 8 years ago now, Judy. I'm trying to remember. I
You're
remember there's a long timing. Kind of a cute story. In the process of, getting ready to have my own business, I was in Excel a lot, and trying to just a
Oh,
lot of things on the computer and research. And um, I started parking sideways, like not totally, but just crooked, right? So I go to my optometrist. I'm like, am I just like a rude Parker or did my eyes change? And she goes, well, your eyes didn't change, which I thought was so cute. But she goes, because of all the eye strain from the screens,
oh.
that's probably why you're a little crooked when you get out of the car. So she changed my prescription a little bit, blue
Mm,
light glasses and things. And now we're all good. But
okay.
so I think part of it was I'm just very analytical. So really diving in, understanding what goes into starting a business and then specifically audiology. But I
Right.
also think part of what makes us unique in our practice is it wasn't just audiology. Like I loved at that time TED Talks, podcasts, right? Those I was getting all this information about different areas and it just I feel like gave it a more balanced approach, right? And really helps me look at my patients, their families, really as whole people,
Hmm.
and looking at the world, how we fit into all of that. So I think that for me, uniquely, was a big part of my process. And I can't imagine having done it without that. Even if it was totally unbusiness related, I think it weaved into what we do differently here.
Yeah, for sure. Um, it's hard to start a business. It doesn't matter what field you're in, but just the core learning of how to start a business and be an entrepreneur is just so hard. And it's disruptive to what you really want to do, which is help people with their hearing, right?
Exactly.
So over the years, how have you balanced that? Because I'm guessing that your business has grown and changed and to become what it is today in 7 or 8 years.
Yeah, I think that's a great question. I think there's been a few times, right, where you have an idea, you think right? And then life experience is like, no, that is not actually how the world works. And so you kind of have to grieve throughout the process sometimes, right? Bits and pieces of it to actually, like you said, get where you want to go, help
Hmm.
the people you want to help.
Hmm.
And so that took me some time to let some things go and then once I did, right, it was like, wow, this is so much easier. This is so much better for the patients, right? And so that openness and to feedback to how things really work in the real world, right? I think is a big part of what's changed in the last 7 to 8 years.
Mm.
And as you get to have a bigger business, obviously you have a bigger team, right? And more people in that process. I guess we talked a lot about my self learning. There's lots of networking, right? You're meeting with interesting people and getting together, your own consulting teams and accountants and all those people that give you
Mm.
confidence in what you're doing and are
Hmm.
looking out for you
Yeah.
so that if something's veering, it's like, hey, you're working too hard here. Why don't you try this? And so I
Mm.
think that has been a big part of my process too, is getting the right team with me day to day, but also behind me,
Hmm.
behind the scenes.
Yeah. So your practice has grown because you've added another audiologist. Is that
Yeah,
right?
yep. Dr. Vaglis, she's doing great.
How did you find her in the sea of audiologists out there?
That's a great question, kind of tying back to the networking piece. So we had
Okay.
met at a conference a year and a half earlier, um, and was living in North Carolina at the time.
Hmm.
But she remembered that I was there and kind of the ethos of the business and what we were talking about while we were in the conference and training together. And she reached out to me and was like, "Hey, I'm moving back to Colorado to be closer to
Really?
family. I'd like to work for you." And I remember it was a big moment as a business owner
Yeah.
to have that experience. So at that point, I also need to check my ego and say, okay, is this the right time? Right. All those things coming
Right.
together. And it was, which was really neat experience to go through. And I'm very grateful for her to have given me that opportunity to grow as an owner who now has a second provider too.
Right. Yeah. A lot of pieces have to fall into place, just even space wise, financially, the number of, clients that you have and bringing in new clients, all of that has to fall
Yeah,
into place. That's
exactly.
amazing. Yeah.
Yeah.
Well, congratulations on growing to another audiologist. That's great.
Thanks, Judy. I appreciate it.
The audiology method, how did that name come about?
That's a great question. So, I don't want to put a bad taste in anyone's mouth towards audiologists because they all work very, very hard within the systems they have. But up until recently, and I think there's been a major shift because people with hearing loss are much more informed consumers.
Mm,
Only 30% of audiologists were following best practices, right? So, like, in some situations, they don't even have the tools to
mm,
be able to perform those procedures they need to do things the right way. So when I started my practice, it was very important to me that there was a high value, good, what's the right word for that? Uh, a high standard, right?
mm-hmm, mm-hmm,
Option available
mm-hmm,
to people who wanted that, right? Who
mm-hmm.
wanted to hear the best they could today, but also moving forward, right? So if we can get them improved to 100% hearing and keep them there, it actually helps preserve the clarity in their brain. It helps with falls prevention. It
Mm,
helps them have less depression, more quality of life measures. So I was looking at with that method, right, was using best practices, but also continue that relationship long term to make sure they stayed at that level and continue to improve over time. And if their health changed, to keep up with that and be a champion for them
yeah.
when that occurred to make sure they had the resources they needed to make informed choices.
So letting your hearing loss go, which is easy to do as you age because there's so much we got to deal with, but could be lifelong implications of letting your hearing loss go. Tell me a little bit more about that.
Yeah, and what's neat is part of my team is I have a team member who actually once a week goes to physicians' offices and educates them on these things we're going to talk about today, which is pretty cool. So, like this quarter, she is bringing them research related to untreated hearing loss and falls. So, I have a patient that I saw last year with untreated hearing loss, came back today, or not today, last week, has not treated it. He's had 2 falls in the last year, right? And so obviously, we look at our balance, it's our touch. So if you got neuropathy, things like that, right? If you have limbs that are weak, injuries, it's your eyes, right? So if you can't see properly, you're more likely to trip over something, but then your ears actually drive the whole system. And so they've found, if your ears are compromised, you're 3 times more likely to take a fall. And then if your ears are different from each other, even
Huh.
more likely. So that's a big thing because that's, one of the leading cause of death, right, for older people is falls. So if we can prevent that, that really improves quality of life. In addition to that, they've found in the last about decade that hearing loss is the most modifiable risk factor to dementia. So part of it is if you can't hear it, obviously you're not going to remember it later. It never got to your brain in the first place. But the interesting piece is you may hear it short term, but you might have used all your resources, especially if you have neuropathy, vision, other things going on. Like you said, as we age, you might use all your cognitive resources up. You'll hear it short term, but you won't be able to remember it later. Right. So it doesn't go into that memory. There was nothing left to put it there. So that is, I have a patient who came to me after a fall who had severe hearing loss, never had it treated, but he really wanted to get back to playing soccer, Judy. And so we were able to talk to him about the falls risk. He finally got to full-time use of his hearing aids. He came back a year later, and like his cognition is so improved. And there's no guarantee. They're still working on those studies, but I could see it in real life. And I was like,
Wow.
wow. And for him, that motivator was he wants to go back to playing soccer and he doesn't want to take any more falls. But he is like a whole different person now. And I get emotional thinking about him
Mm-hmm.
and his family. He's a young guy. He just turned 70. He owns his own business, has a lot of grandkids. Like to be able to change the trajectory of his next decade was really special.
Wow, that's a powerful story. That's really inspiring. I'm emotional just hearing about it. When you say he's a young guy, he's only 70. That makes me feel
Well,
really good too,
like a lot of
Julie.
my patients live well into their 90s. So I'm like, I don't know how long you have. I want you to have the best quality of life that you want to have during that time.
Yeah, for sure. Now, you're very education oriented with your patients, especially new patients. So there's a little booklet and all the information. So I want you to tell us about how that came about, which is such a great tool for new people to learn when they don't know anything about their ears to begin with.
Yeah, so I kind of discovered, actually this started when I was in audiology school. I had a issue with my gallbladder, and I remember seeing the doctor. I'm sure he was super busy, but like he took the time to draw my gallbladder on the picture, right, on the board, and to tell me what was he thought was happening. And I just remember feeling so empowered in that
Mhm,
moment to understand what my own body was doing and what my options were for moving forward.
mhm,
And I think that has always stuck with me. I think about him every once in a while. Like I'm like kind of like people with their ears. I didn't know anything about my gallbladder. It's not like I get it tested every year, but we do often test our eyes and our teeth, right, pretty frequently. So when people come in, they don't have a baseline understanding. Like it's not just the part sticking out of your head, right? We hear with our brains. So to educate them on that allows them to understand their own bodies better. But also, when we get to the end and we're talking about recommendations and findings, they can, and again, it helps to do that over and over again over years, right? Where they can build on that knowledge, but
mhm,
they can start to have that information to, again, make informed choices for themselves.
mhm. And when there's a need for hearing aids, is that how do your patients receive that information and how do you move them into the right decision for the best it's devices, right?
That's a great question. So I think, in the last 5 years, treatment has been much less stigmatized. I want to give a shout out to my audiologist friend in Austin. She's got a great practice there. And I remember going there last year
Mm,
for a bachelorette party, and there's all these young men on the patio, and they like all had hearing aids, Judy. And I was like, go, oh my gosh, like Dr. Jill is doing great. Like it was so cool. Like, so I do feel like it's becoming much more normalized in society. A lot more patients come in to me saying, I am concerned that I am noticing cognitive changes. And I think my hearing loss is part of it. So they're getting that information, whether that is from media, that is from their own doctor, as audiologists try to educate, physicians about that connection. Um, so it just depends on the person, right? For
mhm,
sure. But a lot of, I would say, baby boomers,
mhm,
they want to live a nice, long, healthy, high quality life, right? They're
mhm,
not willing to just fade away.
right.
And so I find with that particular generation, if there's something they can do, they want to do something,
Yeah.
right? They're not like, oh, just part of getting old. They're like, I'm going to beat this, And so
Right.
I feel like it's usually really well received. They kind of, you have a sense, right? Either your spouse has said something to you,
Mm,
your children, your colleagues, right? Or you've picked up on like the birds, right? Someone
right.
says, "Oh yeah, you hear that tweeting over there," and you don't, right?
Right.
So I think often that's the case. Obviously, it's not every case, but I'd say more often than not, that's what I see.
Yeah, I had a preconceived notion that, you don't want to have hearing loss because you got this big apparatus that's on your ear that everybody sees. And I don't think, I mean, there's a lot of times I haven't even, and especially with men who have shorter hair, I wouldn't have even known that they've got a device. So apparently the devices have changed dramatically over the years.
Exactly.
Yeah.
They're pretty cool. I had a patient yesterday. He brought his dad in.
Hmm.
His dad's 93. He doesn't have hearing aids. And so we're talking about treatment.
Hmm.
He was shooting groundhogs in his backyard and blew out his ears 7 months ago. So, this is a new thing for him. And we were talking about it, and I could tell that, vanity was a piece of it. And his son's like, Dad, did you know I wear hearing aids? And he's like, what? And he, like you said, he's got nice, clean cut hair, right? Didn't even notice it, right? And so I thought that was really sweet. And he's like, don't take them out. I won't be able to hear, And so I was like, well, this is what they look like when they're not in his ear. He's like, oh, I could wear something like that. And so that was
Oh.
kind of cute. And honestly, I see a lot of that, Judy, is like again, kind of baby boomers will come in and then they'll bring their parents, right? Because they
Mm.
have went through the process. They feel like they
Oh.
can help them through the rehab that comes along with that. But
Hmm.
also they've seen what a improvement it is for their quality of life, and they want that for their parents. So it's kind of cute. Like it actually goes that direction
That's
versus the other
amazing.
way more often than
So
not.
when you say rehabbing to be wearing them full time or something, what does that mean?
Yeah, so when people treat their hearing loss, they have to retrain their brain how to hear, right? So
Oh.
it's kind of like I like to use the analogy going from black and white to full color, right?
Oh.
So if you haven't heard paper rustling for a long time or your blinker, I would say the bathroom is a whole new experience. A lot of high frequencies in there. That's usually the sound people lose. So they are wearing them all day, every day to hear those sounds, even when they're home alone, right? Because even their jacket rustling, right, makes a sound. And they're practicing in different environments. I always say it's kind of like warming up for like the Super Bowl, right? So they want to kind of
Oh.
gradually build those auditory skills in their brain so that in 12 months, when their brain has fully acclimated, that's when they have their best performance with treatment, whether it's hearing aids or cochlear implants. So that's a big part of our process is helping them along that journey to stick with it. I've been in PT, like we talked about before we jumped on, for a knee injury, and the whole thing will take about 2 years to rehab. But getting that regular check in with my doctor, my physical therapist, right? It keeps me on track. Yeah, you'll
I
have some
see.
days or weeks you're a little off, but you keep your eye on the prize. What's the end goal? What am I trying
Oh.
to achieve? And I need to put in that work every day, right, to get to those outcomes.
Wow. I had no idea that you have to retrain your brain to hear again in that way. So does someone like month 1 hear something, but then in month 8 they hear it differently or more?
Yeah, that's a great question. So, what I've used the analogy of like my nieces and nephews when they were learning language, right?
Mhm.
They'd point to something and be like, "What's that?" Right? And it was like a spoon, right? So you teach them that, you teach the brain that, and then it integrates with the whole picture. So
Mm.
yes, you still hear, right, your clothes rustling, but it's not important information. It's not
Mm.
novel. It's not new. So you no longer pay attention to it unless you
Mm.
have to, right? If it's something that's changed.
Mhm.
So that's why the restaurants and things are take a long time for your brain to acclimate because it's such new information. But that consistent use of their devices every day help them to integrate that into the whole picture so then it can operate optimally.
Yeah, I mean, one of the biggest benefits for me visiting you was awareness of noises around me and how that was impacting my ability to focus, concentrate, listen, hear, ask questions. So I'm just way more aware of that wherever I'm walking into, um, to make sure that I'm going to be in an environment where I can still operate the way that I want to without drowning out all the stuff around me and not being able to hear.
I love that, Judy. Yeah, and that's what we're really about, empowerment, whatever it is, right? Depending on what we find.
Hmm.
Even when it's like, oh, your hearing is, doesn't need treatment with devices yet. There's things that you can do, right, to set yourself up for success. So we always say
Hmm.
control what you can, right?
There you go.
And give you those tools so
Hmm.
that if you feel like you're kind of fading out, this is how you can fade back in.
Mm-hmm. Now, you mentioned earlier that you're in a predominantly women-oriented business in the audiology scope of things. 80% maybe are women. So is that a comfortable place to be as a woman in the audiology fields today?
Oh yeah, definitely. I think that as a profession, it makes us very caring, very empathetic,
Mm-hmm.
very much trying to build each other up and be
Mm.
resources. It's business is business, right? But
Yeah.
I don't feel like it's overly competitive, right? If I'm out of town and my other audiologist isn't here, I'll call my friends down the street and say, "Hey, can you take care of this patient this week?"
Oh,
And so I feel
yeah.
like, again, it's very collaborative. We have, a wonderful organization that really helps to support the business owners in audiology, but also to connect us with each other, working
Mm-hmm.
behind, you know, initiatives and goals to better take care of our patients and to
Mm-hmm.
improve those standards, right? 30% following best practices is not enough. So
No.
how do we get to 100%, right? And
Right.
so they help us collaborate to
Yeah.
make that happen, which is really great.
Yeah, and
Because
I'm
if you're
sure.
not an owner, you don't always have those resources, right? To sometimes make those changes. So they've done a
Right.
good job of empowering them to do that.
Yeah, no, I can understand that as an owner that you can make those decisions to
Yeah.
improve best practices and carry them out in your practice. But yeah, someone who's not in a practice as an owner, it could be challenging to try and move it forward. But
Yeah.
I love your heart, and I love that you're working in the entire industry to bring that to fruition, more toward the 100%.
Thanks, Judy.
Yeah. So, well, Dr. Link, this has been phenomenal. I love speaking with you. Is there anything else you want to share about your practice or um, the the industry as a whole, or an entrepreneur, or being a business owner that you think would be interesting to our listeners?
Yeah, I think kind of looking at your podcast and Inspired Impact, I think having done this for 7 or 8 years, I don't clearly remember everything that was 7 to 8 years ago because it was so busy and so much happening at the same time. But now, this far down the road, I'm grateful to be a female entrepreneur. I feel like it has
Mm,
allowed me to have more grace with other people, but also I feel comfortable asking questions and um, accepting help.
mm,
And I think kind of like you and I connecting, right?
mhm.
I'm not sure if that would have happened if we were
Right,
both men. I don't know.
right.
But I feel like we often band together to help
Mm,
each other out. I was at a Galentine's event
mhm,
a little while ago, and it was all female businesses there. And one
mm,
of the vendors was making custom hats. And she had an example. I think it was like a little saying you could put on the hat. Well, all the other vendors there went and they got their logos put on there. I was like, oh, what a cute, inspiring thing to do. And so they were
mm,
all supporting her business, right? She's like, I
mm,
thought it would be the attendees that were coming to
mm.
see the vendors, but no, the vendors themselves were supporting each other. And I thought that
Oh,
was really beautiful
that is.
um, example of women helping women
Right.
succeed.
That's awesome. I love that. Yeah, and that's kind of the basis of the podcast that I started, is because in my heart, I just want to help women succeed. And if we can get more word out about your business, I think that's absolutely a wonderful thing, because you're such a wonderful person. You have such a beautiful practice. So I'm
Thank you,
grateful.
Judy. You're so
Yeah.
sweet. And I think you're so inspiring in your story. And you've seen, if you are the right fit, it's not for everyone, but for women who take that step and lead in some way, right? Just how life changing that can be for all of us.
Right.
I don't think we'd want to have it any other way.
Yeah. Thank you. So ways to get in touch with you and your practice, your website.
Yeah, for sure. Will you link to that in
Mhm.
show notes? Okay, great.
I
That
sure
would be
will.
awesome.
Yep, the audiology
Appreciate it.
method. Yeah, so all right, my dear. Well, this has been delightful. Thank you so much for your time, and I'm excited to share what we've been talking about.
Thanks so much for having me, Judy. I really appreciate it.
You're welcome. Thanks so much for joining us for the Inspired Impact podcast. To listen to past episodes, please visit theinspiredImpactPodcast.com.